Good afternoon, everyone, or good morning, as the case may be. My name's Kevin Williams. I'm the Communications Vice President here at DBSA. And on behalf of my colleagues, Dante Freeman, who is our Senior Manager of Digital Communications, and Karen Fragoso, who is our Social Media Coordinator, we want to thank you for joining us today. We're very excited to share some of our insights on today's session, which is on chapter communication strategies. And we hope that we're able to share some information that you're going to find obviously very useful for your efforts at the local level. And as a reminder, at the conclusion of our presentation, we welcome you throughout our presentation. We welcome you to put questions into the chat box that we will consider and answer at the conclusion of our presentation. So, as a starter, if we could go back to thank you. Our agenda today, we're going to cover the role and impact of the DBSA chapter system, and then talk about how and why communications is such an essential tool to helping improve outreach at the local level. And then we'll go into a deeper discussion on what is a communications plan and the various elements that make up a plan. So thank you. The next slide, please. The chapter system. It's essential to the way DBSA operates and really connects with constituents at the local level. As you know, we offer peer-run support groups where participants can find comfort and direction in a confidential and supportive setting. The chapters allow our support groups to develop those close and meaningful relationships with their communities. And if our chapters are to continue to grow and expand services to more people, an effective communication strategy is essential, as it must be executed right to continue to raise awareness and enhance outreach and understanding of the services that you at the chapter level provide. Next, please. So what makes a communications plan such an important part of outreach? As you're all familiar with, I'm sure, at the chapter level, resources can sometimes be limited, and we have to be very strategic in how we use those resources. And sometimes this can cause the communications practice to be, let's say, relegated to the bottom of the priority list. But it doesn't necessarily have to be that way, because good communications planning offers a variety of benefits. First of all, it allows you as a chapter to speak in a unified voice, which improves your ability to reach a broader audience. It also creates an ability to customize your messaging so that you improve your appeal to a variety of diverse audiences. And this is very consistent with the DBSA goal of expanding access to more diverse audiences, many of them who traditionally haven't had access to mental health resources in the past. The communications plan can help you reach those audiences if you consider how to tailor your messaging to each of those audiences. It helps you to improve engagement to stakeholders and ensures that our initiatives are understood in a consistent way for all audiences across all levels. And then it helps you to improve your chapter operations by encouraging you, in fact, obligating you to first identify your audiences, establish objectives, and then rank your chapter priorities. And we're going to go into a little more detail on each of these areas as we go through our presentation today. So the next part is let's talk a little bit about what is communications plan and what are the essential elements of it. So a communications plan is first a policy-driven approach to how you provide your stakeholders with information about what's happening with DBSA and for DBSA at that chapter level. It defines who should be given specific information and when that information should be delivered. It determines the communications channels that you use to deliver that information, and it anticipates what information will need to be communicated to specific audience segments. And then lastly, a communications plan helps to address who within the chapter structure has the authority to communicate confidential or sensitive information and how that information should be disseminated. Is the best way to send that information out email or through a printed report or a formal presentation? Your communications plan can help you answer that question. And then lastly, a plan will help you define what channels your stakeholders will use to communicate back to you, to solicit feedback, as well as to understand how that communication will be documented and archived. So it's a way to keep a two-way access channel open so that your stakeholders know that you're listening and responding to them in kind. Next. Communications plan, we have broken out really into what we call 5 essential pillars. Those are objectives, target audience, messaging, content, and lastly, channels. So next, please. I will start to give an overview on objectives. When we talk about objectives from a communication standpoint, we're really answering the question of what are you trying to accomplish? This is the why behind your communications plan. Why are you executing this communications plan in the first place? Your objectives will vary depending on the focus that you put on your plan. For example, is your objective to raise awareness of just the basic chapter activities within your region? Is the objective to raise awareness about certain causes? For example, the need to expand access to services to underserved communities. Or the objective might be to raise funds, financial support, or to recruit participants to join your local support group. So the focus of your objectives will obviously drive the elements of your communications plan. While you're developing your objectives, we also want to encourage you to be mindful of the need to tie your objective to concrete goals. This is important because it's going to help you to track progress towards your communications plan. It's almost easier to develop a communications plan and then execute a variety of practices, but unless you're tracking the progress, unless you're putting a system in place to determine if your communications plan is helping you to reach certain objectives, it's going to be difficult for you to determine if your plan is in fact effective. So we use what we call a SMART goals template to help us develop measurable, concrete objectives that can be tracked. And SMART is an acronym for specific. We want to make sure that we have specific, measurable goals that we want to track over the course of our communications plan. They're measurable. We want to determine how often or what sort of reach we want to achieve as part of our communications plan. They're assignable in that we determine who within the chapter structure is going to be responsible for managing that aspect of the communications plan. So you want to know who's in charge of the email campaign, who's in charge of your social media campaign. The goals are realistic within the context of the resources that are available to you and your specific chapter. You want to make sure that your objectives are in line with the resources that are available to your chapter at that time. And then lastly, they're time related in that we measure our objectives within a certain time window, whether it's a month, 3 months, 6 months, or possibly even a full year. So for example, these are a couple of examples that I hope can make this a little more clear. If you're engaged at the chapter level in a communications plan to reach out to your local media, your local newspapers or your local radio, to let them know more about your chapter activities or some of the more important priorities at the chapter level, one way of tying your objectives in a measurable way to that is to track, for example, how many press releases, how many emails are you sending to local reporters or journalists on a monthly basis? If you have a social media campaign that you're trying to launch locally to invite more engagement, one way to track that is to determine how much engagement your social media campaign is generating on a monthly basis. So you track the number of likes or the number of comments or even the number of shares. So these are two examples of really positioning your objectives within a SMART goals template. Next.
So you have done that. You've laid out all your objectives. You know what you want to talk about. But now we need to figure out who you're talking to, right? And when we do that, we need to do a couple of things. So one, we need to figure out who our main stakeholders are. And so these are the people who are invested in what your local chapter or your local support group is doing, or people you're trying to attract to your local chapter or local support group. We also need to understand their goals. So are they looking for a support group? Are they looking for mental health activities that your chapter may be putting together? Are they looking for general information about depression and bipolar? We need to understand that to figure out what message we need to craft for them in order to make them a stakeholder that's invested in our chapter. And then finally, we need to figure out what's the best way to interact with them. I know on the chapter level, word of mouth is very, very valuable, right? On the chapter and support group level. And so how do you start that conversation in your community? But there's also other ways. Kevin mentioned social media and reaching out to local media, and that can be valuable too. Even if you're like, nobody reads this paper, you'd be surprised by how many people pick up a paper even these days. So having those touch points and figuring out where to interact with your audience is super important. Another easy way to figure out your target audience, oh wait, before we go, can we go back? Sorry about that. Another way to figure out your target audience is creating a persona, and we'll deep dive on how to create a persona here in a little while, but you just want to collect information about a specific person that you want to reach out to in a demographic area. And then that job's to be done. Again, we'll do a deeper dive into this, but you just want to understand the true problem of your target audience, right? So you want to know, how can DBSA, how can your local chapter help them accomplish their goal? So let's talk a little bit about what stakeholders look like. So stakeholders for us, and this list is non-exhaustive, but peers, so that's people living with depression or bipolar, right? Parents of those people, and family members and caregivers of those people. Educators, if you are trying to reach, if you're on the same content train that National is on, we are doing a big outreach to educators right now with our youth mental health initiative. So you can leverage some of that information that we're putting out and use that for your pitch to them. Government and political leaders, especially on the local level, right? They can get local change done. So if there are mental health resources and services on the local level that can be bolstered, reaching out to your local government or political leaders is important. Community-based organizations are a great way to reach audiences that you don't directly speak to, but you have resources for, or you think will benefit from resources. So these could be like local church groups, community centers, other groups that are specific to an audience that you can partner with. Maybe they need a mental health booth, and now DBSA Grand Forks is at that mental health, or at their conference, being the mental health spokesperson there. Business leaders are a great way to gain some legitimacy in your community. So partnering with them or having them support your local chapter. Healthcare providers are a great way to get information about the healthcare world back to your chapters and support groups, but also gives you a place where you can get a clinician to talk to a webinar or talk to a support group or hold a meeting with you and discuss a specific thing. And then media representatives, of course, are always good to get those media placements when you can. So Kevin's going to talk a bit about what it means for the jobs to be done.
Yeah, thanks, Dante. So we touched on this a couple of slides ago, but part of the process as you determine your target audience and determine the messaging for your target audience is you have to understand what's important to your audience. What's the message that's going to really inspire and motivate them to respond to the communications they receive from DBSA. And in order to do this, you have to take the step of understanding what's important to them. And we call this technique the jobs to be done technique. And basically, that's undergoing the sort of demographic and even psychographic research to an extent that you need to do to understand the problems that are important to your particular audience. And we call that problem the job that needs to be done. An example would be if you're executing a survey to online donors to better understand what drives their motivation to support mental health organizations like DBSA. Your survey, to understand an audience, you might ask a number of questions on your survey. For example, what factors were important to them when it came to deciding who to donate to? Or did they ask anyone else about what they thought about local DBSA chapter? Or if they had any particular anxieties about donating decisions to mental health organizations like DBSA, and if so, why or why not? A couple of personas that we created for the basis of this exercise and presentation are Daisy Donor is one individual, and Phyllis Funder is another individual. So next slide to get into a little more detail on that. So for example, Daisy Donor is age 28. She's a marketing associate, and she's looking to support healthcare organizations that align with her values and make a tangible contribution to her community. So for her, and in her instance, the job that needs to be done is the fact that there are many mental health organizations that she can consider, but she has difficulty determining where her money should go and how it would make the biggest impact at the local level. Another persona that we created is one that we call Phyllis Funder. She's an executive and managing director at a foundation that supports other healthcare concerns. She has a strong desire to make an impact in her work, and she wants to fund healthcare organizations that have a track record of success. In her instance, the job that needs to be done is she's a little bit risk averse. So she's hesitant to fund newer, unproven organizations. She wants to support organizations that have a track record of tangible results. So we can take this information that we know about each of these individuals to inform the type of communications and even the ways that we would try to reach each of these individuals with our messaging.
So we have those two personas laid out, and we need to figure out exactly how we want to speak to them, right? With the information that Kevin laid out. So one thing to keep in mind, and this is something that the comms team talks about constantly is making sure that the message is concise, that that message is easy to understand, and that it's consistent across all channels. Now, consistent across all channels can change depending on what your campaign is, but for the most part, those are the three things that you want to make sure. That it's concise, easy to understand, and you're saying the same thing across all channels. So that's your website, social media, or newsletter, email, what have you. And that messaging should be directly informed by your objectives that you have and the objectives of your target audience. So how can you blend together your objectives for the year? How can you blend that together with your target audiences and make content for them that will attract them to get that job done, right? You want to make sure that you adopt that core message so that they understand by investing in your local chapter or signing up for your newsletter or joining your support group that it is actually helping them achieve their goals. So you need to demonstrate that in your content, in your messaging. And you need to make sure that your future messaging is mapped out individually, so tailored for each of those stakeholders. So what works for one group of your stakeholders may not necessarily work for another group of your stakeholders, but the core messaging is there. So you just need to figure out how to tailor it to that specific audience. I'm going to go into a little bit of detail about it, so it won't stay ethereal. So next slide, yes.
In
All right,
this,
so go ahead, Kevin.
no, yeah, just in this instance, we take that Daisy donor persona, and if the overarching communications objective is to help increase funding, we attach that. We might attach a SMART goal of our communications to an audience comprised of Daisy donors by saying that we want to increase our monthly donations by, let's say, 3% by the end of the second quarter of next year. What are our messaging pillars? We want to talk about how the DBSA local chapter hosts so many support groups each month. Because remember, this individual wants to feel like her donation makes an impact at a tangible level at the local level. Our messaging might also include the fact that her donation and donations like hers can help your local chapter continue to meet the needs of more than however many individuals today who are being serviced currently by your support groups, and how her donation can help expand those support groups by allowing even more people to join by the end of the year. So if you can follow us, again, our messaging is showing her that her donation can help make a tangible impact by expanding access to support groups at the local level. And then we strengthen our messaging by including a testimonial by an individual who is currently participating within the support groups. And we get a quote or a statement from that individual who can talk about how helpful the support groups have been to her in helping her find a way to manage her mood disorders on a daily basis.
So what does that actually look like? What are you actually making for Daisy Donor, right? And I know a lot of us here have heard the phrase content is king, and unfortunately that has not changed. And so we need to make sure that we're making content that helps our target audience, helps Daisy Donor make a decision. And so what are we asking them? What are we asking this content to do? If we're making content, what is it to do? Is it raising awareness, right? Is that easy to understand content that brings your audience information in a way that they like, right? So is that a paid ad on Facebook advertising your support group? Is that a podcast episode talking about the impact of your chapter on your local community, right? So how has the local support groups affected Grand Forks, the mental health, how has it impacted the mental health needs in Grand Forks, right? Are you making a video or a blog post that now live on your website, right? Are you making content that is attractive to Daisy Donor, right? And other earned media placements for you. Can you reach out to a reporter, or has a reporter reached out to you, especially during this time, right? Today is Mental Health Awareness, World Mental Health Day. May is Mental Health Awareness Month. September is Suicide Prevention Awareness Month. Those are great times to put your chapter in front of a local reporter or a local news station and demonstrate the benefit of your local DBSA chapter to the community, right? We also need to consider where we're meeting our audience. I just named a bunch of stuff up there that largely lives digitally, right? But everybody isn't digital, and everybody isn't receptive to the content above. So are there other places where you can make content that is more in depth or is more tangible to a certain audience, right? So we have those in-depth articles. A prime example of this is if any of you read like our Gen Z article on their approach to mental health, or other articles that we've sent out where they're long form, right? Where we sat down with a couple of experts and did the research, and then DBSA wrote an article. Are you doing a case study? Are you partnering with your local university or college and doing a case study on mental health, and then taking those findings and showcasing them back to your community? Or are you being invited to webinars or hosting your own webinars, again, whether your local university, a local clinician, a local mental health advocate, where you're hosting these webinars and showing it back to your community. And all of this feeds to provide that gentle push to your audience. So you're taking those things that I just said, whether it's a blog post, whether it's a webinar, and you're putting it in your newsletter, you're putting it in a targeted email to Daisy Donor and saying, here, you're demonstrating what your local chapter has done. So here is a case study we done. Here is an infographic made from that case study that's easily digestible for that audience to make them, to showcase the benefit of support groups and then make them donate or push them to donate. And you can't forget the impact of leadership and storytelling, right? You can get a good testimonial, you can participate in a speaking engagement, you can even write a great op-ed, but if you're not taking that back to your community, if you're not taking that back to your chapter, back to your support groups, if you're not giving it back to them in a way that demonstrates your benefit or showing your impact to your community, then you just sat there and created content that no one likes. So make sure when you're getting this information, you're thinking about, how does this information get back to my audience? We'll have Karen talk about channels.
Oh my God. I'm so sorry. Okay, sorry about that. So now that we've identified our objectives and our target audience, it's now the final step of trying to figure out where are we going to distribute all this information that we have. So you can go social media, website, and internet branding or messaging. For each one, there are things that we need to consider, and that is purpose, success, and failure. The purpose of each one can be something as simple as distributing content or one-on-one engagement. So for example, distributing content would be great for social media, and one-on-one engagement can be really website or social media. Purpose is really, why are you choosing to distribute onto these sites or social media sites? And then you need to define success and need to learn or determine how to define failure. So it could be either the complete opposite of what you wanted your results to be for success, or it could be things like the percentage of engagement or percentage of visits to the website, clicks. Next slide, please. So the top channels for communications are social media. So LinkedIn, TikTok, Twitter, Facebook, Instagram, websites and blogs. For this, you could go DBSA website. I think certain chapters have their own websites too. Kevin, I'm asking you to confirm.
Yes.
Okay.
Yes.
Email marketing is great. Reaching out to all those, stakeholders via email. A lot of people still are using email, and you get a lot more, you can get really good data on your email marketing. Influencer marketing is something that we have started recently, and it really allows you to find people who are really big advocates for for mental health on social media, and they have pretty big platforms with people who are looking for communities to engage with and have these discussions. So using marketing or using influencer marketing to reach more stakeholders, peers, is a great way of going or communicating. SEO or search engine optimization is also really good for websites. It's taking those key phrases that are used when people are Googling things and doing whatever you can to make sure that your chapter website, DBSA, is the first thing that comes up. Podcast marketing is something that we tend to do a lot too with I'm Living Proof and the DBSA podcast. Word of mouth, as Dante said earlier, is the biggest way of marketing for chapters. And omni-channel marketing. Dante, can you go a little bit deeper into what that one is?
Yeah, omni-channel marketing is, like I talked about earlier, when you're being consistent with your messaging across multiple channels. And so whether that's what you're writing in the blog post, what you're putting in your email, and what you're talking about on the podcast, that those pillars are staying the same across all the channels that you're doing. When you're thinking about different audiences, you have to figure out where to meet and hit them with your messaging.
So there's also important to develop communications materials. So that's anything from press kits, press releases, newsletters, PSAs, or letters to the editor. I know that we have done a lot of press releases. We do, I think, monthly newsletters. I'm not too sure on how we've been doing PSAs or public service announcements.
So we have a PSA running right now for the Black support groups. They're things that we may do once or twice a year. They take a little bit to get off the ground, but we do them. And then letters to the editor. You can just, again, partner with your local media source and get a letter to the editor in the newspaper or on their website. So we talked a lot about how, we talked again a little ethereal about how to do this. Let's focus on Phyllis and showcase exactly how we would plan out talking to a Phyllis funder, right? So Phyllis is a little different than Daisy. Daisy wanted tangible information about how your chapter will impact her local community, right? And Phyllis is a little risk adverse, right? So she wants to fund something that showcases a strong impact through her work, right? She's a little risk averse. She's not familiar with DBSA. So how do we break down those barriers for Phyllis, right? One way to do that is to take DBSA's national messaging and funnel that down to your chapter or support group, right? So take our national reputation of having X amount of chapters and 400 plus support groups, and then say, because of that, because of this system or this structure, DBSA Grand Forks is able to have X amount of support groups per week under this umbrella. And so that's an easy way to marry reputation with your local level of support. And you can also talk about your roster of current or previous funders, right? So an easy way to think about this is, where are you having your support groups, right? If you're having your support groups in a hospital or a community center, right? That's someone who may not be directly funding you, right? But there's someone who believes in your chapter or believes in the mission of your local chapter or support group, that you can showcase to Phyllis and say, hey, we already partnered with them. They really believe in us. And we've worked with them for the last 5 years, right? Kevin really touched on the importance of testimonials. You see DBSA National do this all the time. It is great to package the actual impact of that a support group or a chapter has on a peer. That's invaluable. So talking to your support group members, talking to even talking to local businesses who see your impact and gathering that information and making sure that you have it on hand so you can say, hey, Ben said he found community at DBSA Grand Forks. Again, I talked about that local endorsement. If you already work with business partners, just having them write something or showing support for your local chapter is great. And that media coverage, again, perfect time. October, great. May, great. September, great. These are all times where reporters are looking for quotes. They're looking to speak to people about it. We all know that mental health is like hot right now. So they are looking for it. You just need to either check your email or email them and figure out what they're working on for the month and then get those media placements for you. That's another way to show that you are actually in your community. And don't be afraid. Reporters get a lot of requests all the time, but you have no idea how many times they'll be happy to see an email from you because it helps them write their article, right? And then that thought leadership website content, again, those longer form articles, those talking to an expert. Again, we here at DBSA believe that peers are experts, but we also have to play the larger game, right? So talking to a medical expert, or clinician, or somebody working in the mental health realm, or having them come speak to your local chapter, that's all great. Now that we gathered all that information, how do we get it back to Phyllis? How do we make sure Phyllis sees this? Again, making sure that it's on your website if that's appropriate. For social media, I'll show you a great way that we do this. Say you got a great testimonial from Ben. You're like, this is great. We know that Ben's testimonial will speak to a lot of people in our target audience. What we do is we grab a powerful quote from his testimonial. We'll make a graphic, a social media graphic. Karen will get that out. And then that graphic will lead back to a longer article that has Ben's testimonial in it, and then something else that DBSA is relating to. That way you're showcasing the impact. You're saying here's how we're impacting peers in our community, and here's what else DBSA is doing, and you're getting those website clicks back. Same thing for your earned media. You want to stay on those messaging pillars that Kevin talked about earlier, so that when someone reads that article in the local paper or on the website, they're clicking back to DBSA Grand Forks, right? They're clicking back to your local support group and they're getting that information. And then those email campaigns and newsletters, it's important that you just did all this work. You worked all month to get testimonials, to get local endorsements, to get other media coverage. You have to tell your audience, all your audience, about this. So putting that in a newsletter and sending it out to your audience at the beginning or end of the month, just to remind them what your local chapter did, is another just touch point. You want to have 5 to 7 to 10 touch points if you can, because you don't know which touch point. Unfortunately, we don't know yet which touch point is going to resonate with which person, right? But we know that Phyllis is getting some of this. And one of those things, or two of those things, or three of those things can push her to actually funding your chapter. Key performance metrics. I'm not going to stay on this long. Kevin or Karen talked about this, but that website engagement. How many hits did you get to your website? What was the most popular content? What was the most popular blog post, right? How many comments, likes, or shares did you get on that testimonial graphic? How many email opens did you get? If you have an open rate that's higher than 20% on your last email, you know you're doing well. Now, how do we turn those open rates into click-through rates? So they read the email, did they get back to your website? Did they donate? Did they join the support group? If it's less than 20%, then you know you need to change up either the content that you're putting in your email or your subject line, or maybe the email is just too long, or maybe you just need a simple CTA, right? And then those earned media placements. How many earned media placements did you get this month? And like Kevin said, how many did you actually proactively go out and get, and how many came towards you? And then keeping track of that so you have a benchmark for next year when you want to do a bigger campaign.
And I will briefly review this slide. This is also part of your communications planning, as we said earlier, about making it time related, putting in place as part of your plan a timing mechanism so that you can track progress in terms of, are you doing the things you said you would do at particular time points of your communications plan. As an example, if you were interested in promoting the results of, let's say, DBSA National just completed a new survey, new stakeholder survey, which provides new insights on how the peer community feels about mental health resources that are provided today. And you wanted to help promote awareness of that at the chapter level. This might be an example timeline for you to consider for your communications plan. Let's say 10 weeks prior to releasing information about this survey, you want to define the goals and objectives, define key audiences, and detail your communication strategies. 8 weeks in, you want to finalize your key messages. And if you have press materials, most likely digital press materials, maybe you want to develop those to send out to local media. And you want to start reaching out to the local group of advisory board members that you and your chapter perhaps work with. 6 weeks before, you start fine-tuning and developing your media list, and also complete development of any media press materials that you'll send out to local media. And about 4 weeks before you want to make the formal announcement of the survey results, if available, you may want to shoot some video that you make available to local TV stations. You certainly want to consider media training people who speak on behalf of your chapter, so that when the media responds to your sharing of information about the survey, you have a group of people prepared to speak to the media and deliver the right key messages. If possible, schedule editorial board meetings with local media, or even one-on-one meetings, so that you can discuss the results of the survey with key influencers. And then 2 weeks before, you want to create your press release that you'll distribute to local media, maybe even draft a public service announcement that you make available to local radio stations. Maybe consider putting some information up on your local social media channel. Other parts of your timeline might even consider holding a community forum with one of your community partners to talk about the results of this survey and how it might impact efforts to expand access to mental health resources at the chapter level. And then, as the information about the survey is released, you want to draft and pitch maybe a trend story to the media that's related to the survey results itself. So not only are you sending information out there about the actual results, the raw data of the survey, you want to connect that data to trends that are currently taking place within your community. It makes the information more relevant and honestly more interesting to reporters who are working at that local level, because their job when they're writing stories is to make sure that the readership, the listenership, the viewership sees the relevancy of this information to their lives and in their community. You might want to consider, again, a letter to the editor or some other bylined essay that you make available to local media that they might place within their editorial. And if you have a newsletter, certainly you want to consider putting information about that survey in the local newsletter so that it reaches your current roster of stakeholders. Next.
No, Jeff had a question. How do we identify the persons or people to contact? One way, Jeff, to figure out who's in your audience is conducting a, if you have an email list already, you can always conduct a survey, figuring out what people want from your local chapter. Another way though is to, if you have a board, right, you can always ask board members who they have connections to. You never know. Sometimes if you have a close support group. You can also add support group members who they have connections to, and then add those people to if they're receptive to it. But seeing if you can get those people, if you can get a one-on-one meeting with those people, or if they want to be part of your email list, or anything else and they may want to partner with you too. Oftentimes we find at national that people are looking for mental health partners all across the country, and DBSA National just doesn't have our DBSA headquarters, we just don't have the bandwidth to do it. But we do try to direct them back to local chapters. So also keeping, you can ask Carla or Jill, or send requests to media as well, and see if there's opportunities for you and that we run across as well.
I think one other thing to consider is the fact that you can consider the audiences that you have good penetration or good relationships with. And then the counter to that is to think about audiences that your chapter would like to develop better relationships with. So if you're interested in making inroads with institutional funders at the local or chapter level, then you want to start the process of understanding what the institutional funders are looking for at your level. What are they interested in? What are their concerns? That's the start of building a persona around the institutional funder at the chapter level. And once you develop that persona, you understand not only demographically who they are, but what their concerns are. That will inform the type of messaging that you put together, and that's going to inform how you try to reach out to that audience as well.
Any more questions? Don't be shy.
Are we going to receive these PowerPoints?
That's a good question. Olivia, will we be handing out these PowerPoints?
If the team wants to, yeah.
Yeah, we can. Yeah, absolutely. You can have access to this.
Yeah, and also it's important to know that all of our presentations, this sort of Zoom video is going to be made available next week, so that you'll be able to come back to this and watch this. And so that's another way that you'll have access to the information that we've shared today.
Absolutely. Bonnie, go ahead.
You referred to those case scenarios of those two individuals, I think Debbie Donor, and knowing the characteristics of what they would be interested. Is there any way to, as a support group, as a small nonprofit, to know that information, to gather that information, or are you going it kind of by what you're hearing people talk about?
A lot of the, and we recognize, given limited resources at the chapter level, we're recommending that you try to get as much of this information as possible through secondary research. We're not expecting the chapters to do any primary research, but just through, for example, local census data. For example, really looking at the way mental health is covered at the local level, getting an idea of who's funding mental health resources at the local level. That helps you to determine the audiences that are of the highest priority, and you can understand them as best as you can and develop a message and communications campaign targeting them. And at the same time, as I said a couple of minutes ago, if there is, let's say, an untapped resource from an audience level at the chapter level, then I would definitely recommend that you talk to some of your other stakeholders. Maybe you have local advisors who can give you insights about this audience that you'd like to have better and deeper relationships with. Rely on that sort of information that you can get from advisory board members, and to the best that you're able to, put together a persona based upon that. But yeah, we're definitely.
Did Kevin freeze for everyone else?
And is census data available? Like, is that, you can get that?
Yeah, your local census data should be available. Absolutely. I know Chicago not too long ago, released theirs. But yeah, you should be able to get your local census data.
Thank you so much.
Absolutely. Another thing to consider too, Bonnie, is surveying your own audience. So if you have a large email list, just surveying them, seeing where their demographics are, and if identify any gaps or opportunities there, and you can create a persona off of that as well. DBSA just did that a couple of years ago. Jean, go ahead.
Sorry. I am part of a fairly new regional organization, the Pacific Northwest Regional Chapter of DBSA, and I would like to partner with NAMI in like Montana. What would be the best way, or what would you recommend I contact them? By email, or call them with a certain spiel in advance?
So we recommend that you do a couple of things. One, that you get your messaging that you want together, right? So your objective, whatever you want to partner with them on, you have that all together. You have your elevator pitch for that, right? And once you've developed that, the next thing I would recommend that you do is, look for the contact information, see if you can get someone on the phone. If not, see if you can email someone. And if not, from there, if you can't email someone or you can't get someone on the phone, find NAMI Montana's social media and shoot them a DM, a direct message on Twitter, Facebook, Instagram. Find where they're the most active, and then that's where I would tailor that message to, and just send them a private message there. And then hopefully someone will get back to you. Someone like Karen or myself will get back to you.
Okay. And I was thinking as you were talking, what I might want to do is have my message already prepared, make the contact. If I have to leave a message, say, I'm going to follow up with an email to you with my message, because I hate leaving long voicemail messages that never get listened to. So thank you.
You're welcome, Bonnie. Thank you for coming. Well, if you have other questions for us, you can always email us at media@dbsalliance.org. All three of us here get that email, and so one of us will reply to you. Also, you can, if there's anything that you see on the DBSA website and you're like, hey, can I use that to leverage my messaging? The answer is yes. So make sure you use the information that we send to you via email on our website or on social media. That is for you to use. And then, we'll get this PowerPoint out to you guys as soon as we can. And we'll be here for a little while answering any questions that you guys have. But thanks for coming, and thanks for listening to us.
Yeah, thank you very much.